And welcome to our Sunday special. Teenage pregnancy remains one of Nigeria's most pressing social challenges, cutting short the dreams and potential of thousands of young girls every year. In this special report, Olaido Yewole examines the growing trend of teenage pregnancy in Nigeria, the causes, the consequences, as well as the stories behind the statistics.
Across Nigeria, teenage pregnancy is silently stealing the future of many young girls. It is a reality many communities across Nigeria are grappling with. Teenage girls getting into early motherhood. According to recent statistics by the federal government, 15% of girls between the ages of 15 and 19 are either pregnant or already mothers. That's not all. According to the United Nations Children's Fund, Nigeria records one of the highest rates of adolescent pregnancies in sub-Saharan Africa. Let's put that in perspective. Imagine a hall filled with 1,000 teenage girls, and almost 100 of them are already mothers before they turn 20. That is 1 in every 10 teenage girls, a figure that shows just how deep the crisis runs. For every 1,000 girls aged between 15 and 19, 93 have already given birth. The figures raise tough questions. Why are so many girls trapped in this cycle so early in life? What are the consequences for them, their families, and the country? I met with a young woman whose story reflects the reality behind these statistics. Adetutu, who is now 24, was just 15 when she got pregnant, having no proper education about sexuality, as poverty pushed her into situations she couldn't control, causing her to be abused several times.
One of the major challenges I faced was the lack of basic things that I needed as a child. There are days when we wake up in the morning and there's nothing to eat for days. And there are sometimes debtors come around, they harass my parents in my presence, and it somehow created this pain, this burden on my mind. So I was beginning to see myself as the savior, and before I knew it, I started taking responsibilities for my siblings, for my parents, and it made me more vulnerable because a number of times I had to go out and fend, I had to hawk, I had to go from morning. Sometimes when I hawk and I come back in the evening, I don't make sales. I feel pressured, like now I'm going back home, there is nothing and I don't have anything to show, and I know that they are waiting for me at home for whatever I've been able to gather since morning. So it was one major issue for me, and I began to find comfort and solace in people around, those I knew that they could help me. This led to exploitation sexually and a number of abuse cases that I cannot really remember. Some I've forgotten and some I still have the memories very clear with me.
It didn't just end there. The very moment she was being celebrated as a senior girl of her school, she was also being sent away, forced into her husband's house with her dreams cut short.
In fact, I won a scholarship in school. And it was after I got the scholarship, I realized that I was pregnant. So the day I was being announced as the senior girl of my school, I was already in my husband's house. Now, should we say it was because I was really wayward? No. But what really happened was that majority of us, we are dealing with survivor. We just want to survive. So when you see somebody doing the wrong thing, most time the motive is not because of peer pressure. Because people say, okay, like, for those that understand Yoruba, they'll say she's moving with the wrong friends. No, for some, the motive is just to survive. We just want to survive. We just want the basic things of life. As simple as sanitary pad is, as simple as a meal, just a cup of garri, in the morning it was something that we lacked. So tell me, somebody that wakes up in the morning, does not even know what to eat, the parents are trying but they cannot meet up with it, and that kind of person now getting that offer from someone else, she will just feel like, okay, maybe I should trust.
Imagine being full of promise, just to have your future decided for you in one day, not by choice, but by circumstance. That's the harsh reality many teenage Nigerian girls go through. However, Adetutu did not allow that weigh her down. She's now in her 300 level studying psychology at the University of Ibadan. Experts link teenage pregnancy to multiple factors: poverty, lack of sex education, and even cultural practices.
Family background play a driving force in teenage pregnancy in Nigeria. One, poverty. When the family is unable to provide for themselves, they either send their works to work to provide for the family. And in the process, some of these girls are a prey to the garage boys and others.
Campaigners are now calling for comprehensive sex education, stronger family guidance, and support systems for vulnerable girls.
It is key and paramount that we must emphasize on education. Teach people on sex education. Teach them. In fact, empower the girl child, that the child will be able to know. And then education should be made available and free for them, because a lot of them are dropouts. They don't have, for example, a child that is being raised by a grandmother who is not even learned, who is illiterate. The grandma does not have any reasons for the child to go to school. And then after primary school, she's withdrawn out of school, she starts selling something or hawking on the street or in the garage. And then one irresponsible man takes that child or that girl and then impregnate her, and then our problem starts. Our journey in life with a lot of problems, with a lot of trauma begins. So it is important that sex education is key into preventing all these problems.
And consistent community level programming. The government cannot do it alone. There's a need for more collaboration with NGOs, community leaders. The community themselves need to also step up, because teenage pregnancy is a menace, not just to them, but the community as a whole. And even the private sector need to come on board also. We all need to work together to ensure that social interventions truly reach the most vulnerable adolescents in Nigeria.
Are there short and long-term effects on these teenagers who find themselves in this situation at the tender stage of their lives?
Of course, when they are pregnant, there's a lot of problems that they can have in pregnancy, while they are in labor, after delivery, and even their babies. To start with, in pregnancy, these people are at risk of abortion. And this is because they are not ready for this pregnancy. So they want to do abortion, and then it comes down with complications of abortion, like septic abortion. In fact, some of them might even get their womb removed if it becomes so septic that you have to save their life. Again, they are at risk of a lot of miscarriages. How do I mean? They tend to lose a lot of pregnancy because these people don't have enough support. They don't have enough nutritional support. And so they tend to what? They don't have reasons to go to antenatal care because they don't have anybody to take them there. They don't have even funds or money. The person who impregnated them is not even responsible. So definitely they are at risk of miscarriages. Again, anemia is one of the greatest problems. That is low blood level. These people have nutritional deficiency. They don't have enough to eat. And now when they are pregnant, the baby is also taken out of them. And then they tend to what? Have reduced blood level. And that can even kill them or even kill the baby inside. What about risk of sexually transmitted infections? Because these pregnancies oftentimes are not planned. And so they are at risk of infection. Maybe somebody impregnate them, somebody has sex with them, and then they tend to have, when you are screening them, even when they come for antenatal, some of them are at risk of having things like syphilis, HIV, hepatitis, and things like that. So those are one of the problems or things that they could experience.
Teenage pregnancy is not just a statistic. It's a stolen future, a silent crisis that demands urgent attention for Adetutu and thousands like her. The question is simple. Will society finally give girls the chance to write their own stories? Olaide Oyewole, TVC News, Ibadan.
All right, our correspondent Olaide Oyewole joins me live now on the news to talk about this issue about teenage pregnancy. Olaide, very good to have you with us this evening. Teenage pregnancy, as we know, is a significant public health concern in Nigeria. And of course, Adetutu's story is reminiscent of that of so many that are not told across the country. Tell us, how did this affect Adetutu's family on learning, her immediate family, on learning about what happened to her?
So, to start with, the story of Adetutu is a reflection of what, like you have said, a reflection of what many young Nigerian girls go through at this point in time due to the lack of early sex education, poverty, and most times cultural practices like early marriage and all of that. So the case of Adetutu, like she said in the interview, that ours was because of poverty, and at a time of her life, the parents depended on her to feed and all of that, which led to her, looking for other options for her to get money. And in that process, she was abused in many cases. And she told me that one of the reasons is because she did not even have the education she had right to her own body. So once they come to her and they tell her that this is what they want, she just gives to them, and because of what she wanted at that point in time. So for the parents, for Adetutu to have gone back to school at this point, like I mentioned, she's in her 300 level studying psychology. For Adetutu to have gone back to school, it means that the parents at this point have learned their lesson. She told me that she was pushed to her husband's house, which meant that the girl that was even trying to cater for the family, when that happened to her, they did not even respect her, at least to keep her in her custody, to keep her in their own custody. She was sent to her husband's house, someone who was as like twice or three times older than her at that point in time. For her to be back on her feet at this point, I think the family would have learned their lessons and sent her back to school to fulfill her dreams.
All right, Olaide, these concerns are not new, at all. Is the Oyo State government in any way, trying to address, are there programs on ground put together to address these challenges, let's say, in Oyo State at the moment?
Yes, on several occasions as a correspondent of TVC News in Oyo State, I have covered so many events, related events of such initiative that has to do with the girl child. A lot of programs are in place for the girl child, especially from the Ministry of Women Affairs and Ministry of Women Affairs and Social Inclusion. So I have covered so many. I cannot really recall all of these programs at this time, but I'm quite sure, and I can tell you that the Oyo State government is trying its possible best to ensure that these girls are being treated well and they are being sensitized. They are working with NGOs. They're working with civil societies to ensure that these girls, most of them are even on the streets. They are brought, they are taken away from the street, and they try to, bring them back to the society. So that is what the Oyo State government is doing, and I can confirm that to you.
All right, Olaide Oyewole, our correspondent in Oyo State, many thanks indeed for, of course, talking to us about this issue.